Dr.
Yeah.
Haldar. Dr. Haldar, is it audible to you?
Yes, it's very much audible.
Is it audible? Is
Yes,
it audible?
audible clearly.
I think there is problem. Hello?
Yes,
Yes, sir, you are
Hello?
audible, sir. You are audible, sir.
we can hear you.
Okay, okay. Thank you, thank you, thank you.
Okay.
Thank you.
Yeah, so our station is right now live from YouTube. So I think, sir, we should start. Shim, sir.
Yeah, go ahead. Go ahead.
Shakwar, please mute.
Yes, sir.
Very good.
Except Sujoy Sarkar sir, please mute everyone.
All of the participants are requested to not to unmute yourself until you have been requested to do that.
If they can't. You make me host, I'll do it. I'll do that.
Okay, sir. Yes, sir, you are host now. So good morning, everybody. Good morning to our eminent speaker, and good morning to all the beloved students of B.Pharm first year, Diploma Pharmacy first year, and BMLT first year. So this is gonna be your second induction class with the Department of Pharmaceutical Technology, JISU University. And today we'll be having a session of discussion with our speaker, Dr. Sujoy Kumar Sarkar. So he's our eminent speaker today. So before our speaker starts his discussion with you all, he will let you know about the pharmacy, and he will give you a sense what pharmacy is all about. So before he do that, I will give a short introduction of him. So Dr. Sujoy Kumar Sarkar, currently holding the post of microbiologist and quality manager at Micro Clinical Laboratory and Diagnostic Center Private Limited, Holdia, Purbo Mednipur. He is a former chief microbiologist at Sanjeevan Hospital and assistant professor at Sanjeevan Institute of Health Science, Howrah. Dr. Sarkar received his PhD in the field of microbial genetics and antimicrobial chemotherapy from the Department of Biotechnology, Indian Institute of Technology, Kharagpur, that is IIT Kharagpur, in the year of 2005. He was also joined as postdoctoral fellow research in the above department. And overall, he has more than 14 years of research experience in various fields related to microbiology, molecular biology, microbial genetics, bacterial pathogenesis, and antimicrobial chemotherapy. Dr. Sarkar is involved right now in teaching the medical and allied science on medical microbiology. He is involved in teaching of different paramedical sciences under the West Bengal State Medical Faculty and West Bengal Health University. Dr. Sarkar has more than 10 scientific articles and publications and attended several national, international seminar, webinar, workshop, symposium, and training courses. So this was a very short introduction to our eminent speaker, Dr. Sujoy Kumar Sarkar. So welcome, sir. Welcome in our today's second student introduction session from Department of Pharmaceutical Technology, JIS University. So you may please move on with your discussion. Sir.
Thank you. Very much thank very much thank you for your nice introduction regarding me.
Welcome, sir.
So this is a very good morning to everyone. Hello.
Yeah, sir, all are muted. Only they can chat. Yes, students, please write good morning in the chat box if you wish.
Hello.
Yeah. Sir, please continue. All are muted. That's why they cannot speak. They will write on the chat box only.
Okay. Thank you. Thank you. Let me start the class. Let me start an introductory class regarding the medical micro microbiology and the medical laboratory science and technology. Let me just share. Hello.
Yes, sir. Slide.
Oh, let us start. Yeah. Let us start a short introduction to the medical laboratory science and technology. Okay. First of all, this is a new subject in the virtual medical field, and in such current scenario, era of modern scientific. Just a minute. Hello. Hello. Hello.
Yes, sir.
In the modern era of technology, and this is a good healthcare facility. Let's all of us know about the healthcare facility. Okay, all the students, you can chat me in the chat box. Okay, if you have any problem to understand, you can chat me. So a good healthcare facility deals with so many different personnel and the specialties that must have an understanding and they must have a clear understanding and a clear working knowledge, which leads to develop reliable healthcare facility, including the role of diagnostic evaluation. Now, the fields you are going to study in biomedical laboratory technology and the biomedical laboratory science, which actually deals with the different diagnostic evaluation related to the patient. Patient means those are suffering from the disease. And a good laboratory at the diagnostic stage are the tools for the analysis of any clinical relevant specimen, like urine, like blood samples, and the other, which is excreted from our body or the circulating in our body. Those are not therapeutic. So proper diagnosis for a patient, we just need three different fields, like first three different steps. First is the relevant history in the clinical purpose, physical examination, analytical examination of the clinical relevant specimen, which can confirm or lead to the doctor for proper treatment and therapy for a particular patient. Therefore, a genuine laboratory findings are essential for the study of epidemiological and the research activity for a particular type of disease like an infection. As per current scenario, you know about the coronavirus infection. So the critical and genuine laboratory finding is very, very important in this situation. Is a which type of disease this is, and what is the causative agent that actually creates the disease. So there are a lot of persons, they are working in the, generally works in the laboratory, medical laboratory. And every member of this field, they must need to understand the role of the laboratory and its contribution. Understand the role of laboratory and its contribution to the healthcare, which appreciates the need to involve all members in the provision of healthcare services. They must follow the professional ethics and code of conduct, and This is important for their job satisfaction, that what they have learned, what they are doing, what they are executing, okay, and have their professional loyalty and integrity to the service. This is very, very important. Before going to study this field, the students must have sticked on these points. A general medical laboratory or the laboratory science or the technology actually deals with the multiple fields, which involving a number of different disciplines such as microbiology, clinical biochemistry, hematology, clinical pathology, and the clinical pathology also includes the urinalysis, stool analysis, fluid analysis, etc. Immunology and serology, histopathology, and recently you may know about the RT-PCR, that is under molecular biology, and the others like histochemistry. So there are several disciplines are attached with the medical laboratory science. Like under this discipline, there are several fields like virology is the among the microbiology. This is the virology, needs the study of viruses, bacteriology, mycology, phycology, and the parasitology. Therefore, similarly, the each discipline like histopathology, clinical biochemistry, hematology, they also have their different fields. In case of medical laboratory technology, technology is behind the techniques which actually apply by taking the scientific knowledge to the medical field. Before starting this medical laboratory technology, the students should know first importance of the laboratory service and the role of medical laboratory technologist. They should clearly understand the role of medical laboratory technologist as a technician, as a technologist, or as a medical laboratory scientist. Use of laboratory wares, instruments, and sterilization techniques, prevention and control of the laboratory accidents like infectious agent accident or anything, quality control practices and its assurance. In all together, actually, which develops a quality service provider. If all the students are acquired the clear idea and clear understanding of these 5 points, then definitely they can create an institute, a quality service provider. Therefore, the course is extremely important for the student as it paves the way to easily understand various professional courses such as hematology, bacteriology, urinalysis, clinical biochemistry, and others. Therefore, a great emphasis should be given to this subject matter to that a trained, qualified, competent, educated, and task-oriented like professional medical laboratory technologist can be developed, which actually helps our society by their contribution. The proper diagnosis, which leads to the proper treatment for a patient. If we go back to the previous, a long back ago, although this is very difficult to exactly say when and where medical laboratory science was started. However, some earlier historical references have shown that there are examination of body fluids around the era of Hippocrates. Firstly, the medical diagnosis, if you see just 200 or 300 years before Christ, so medical diagnoses were made by just a human based on their ancient physicians could observe by their naked eye and their ears. And also they studied with the behavior of the patient. Is it a proper diagnosis? Do you think? As per current scenario, we think no. There are something. There are a lot of materials which secretes in our body are present in our body through which we can test and get a clear idea about the human body. What actually disease is now going on in that particular body. So to know that, we have to study this field, this course critically. The ancient Greek attributed all disease to disorder bodily fluids called the humans. At that time, they called it humans. And the body fluids means they only things about the urines. And after discovery of the microscope, then it is revealed not only the cellular structure of the tissue, human tissue, but also there are some micromolecules and some microorganisms. Those are responsible for the disease. More sophisticated and diagnostic tools and the techniques such as the thermometer for measuring temperature and the stethoscope for measuring heart rate and the pulse rate are not widespread use until the end of the 19th century. And all these instruments are used now for physical examination. Okay, so a disease can be diagnosed by 3 discipline categories. First is the history, the clinical history. Second is the physical examination, like measuring the body temperature, measuring the heart rate, pulse, etc. And third is the diagnostics, is the analysis of the fluids, analysis of the excretory materials from our body, etc. So we know the clinical laboratory was not developed until the beginning of the 20th century. Therefore, just last 100 years we developed enough, and now we would like to utilize this development in the branch of medical science. The improvements in the microscope later on, after 1865, after the development of the microscope, then further lot of improvements happened, which allowed further exploration of the cellular and microbial worlds in the 19th century. Previously, one cannot talk about the field of medical laboratory science without also talking about the medical specialty of pathology. I am talking about before 1980. From 1950 to 1980, everybody thinks about the medical laboratory means this is operated by a single person, and that is he or she is the pathologist. First, he is a physician and working in the field for the diagnosis is the pathologist. Nowadays, this pathology is not a single unit. That the different discipline I have shown you in the 3 slides before. There is the microbiology, serology, immunology, like this. The different disciplines, and each and every disciplines have their very integrity. So early laboratory practitioners were the physicians, pathologists, both. That I have mentioned just 3 lines before. But sooner, medical laboratory professionals was developed into a separate discipline having its own educational requirements and the standards. A biochemist is working on clinical biochemistry. A microbiologist working on clinical microbiology. Similarly, and hematologist actually supervises all the work carried out on hematological discipline. So there are distinct disciplines which actually operated by the 3 distinct category of peoples. See, let's go back to the earlier. it's talking about the body fluids. At that time,
Sir, sorry
hello?
to interrupt. Yeah. Sir, your slides
Yeah, yeah.
are not, yeah, your slides are not moving. We are still on the first slide.
My slide is not moving,
Yeah. We are still on the first
but
slide.
here I am seeing the in live.
Yeah, that's a technical problem maybe. Kindly reshare, sir. Please stop sharing and reshare.
Okay.
Yeah, again you can share. কি বলছো? কোথাও বসে? হ্যাঁ। Sir, this is it. The slide is visible. Yeah.
Yeah, is it okay?
Yeah. Sir, this slide.
Is it moving?
Sir,
Is it moving?
1 minute, sir. This slide is
Sir,
saying
now it is
School of
moved.
Medical and Clinical Laboratory Science. The slide says
Yeah, the role of medical or
Yeah, it's okay, sir. It's okay.
Yeah.
Continue.
yeah, it's okay. Thank you. Thank you. Now, so to start this course, we know about the role of clinical or the medical laboratory science. Okay, the medical laboratory services plays a vital role in the promotion for curation or the curative of the preventive aspects of our health delivery system, and that service gives a scientific foundation by providing the accurate information to those with responsibility for the treating patients and monitoring their response to treatment. So, is it clear to you students that the role of medical or the clinical laboratory, the aspects of the medical or clinical laboratory science, which actually deals with the person, deals with the patient who are suffering from various kind of disease, and the treating patient and monitoring their response to the treatment is very important to know the status of the patient by analyzing the clinical sample, and the monitoring the development and spread of infectious pathogens also very much important to save our society, and deciding the effective control measures against the major preventive disease. This is very important. And finally, deciding the health priorities and the allocating resources so that we can control a disease, we can control an infection like dengue, like malaria, and the others, and coronavirus also. If we know the particular region of a disease, if we know the particular region of a disease and know the pathogen, then only we can restrict the infection, then only we can restrict the disease. And the patient is suffering from the disease, then also this is very much important for on that time the diagnosis about the patient status, how the treatment procedure going on, and is the patient is response to that particular treatment or not. So without the reliable laboratory services, the source of the disease may not be identified correctly. If the source of the disease may not identified correctly, then what will happen? The patient will go for wrong diagnosis and finally the wrong treatment. It is not expected for us. The patients will not receive the best possible care. Resistance to the essential drug may develop and continue the spread of infectious disease. Epidemic disease may not be identified on time with the confidence. Let me explain about the point. The source of disease may not be identified correctly. suppose a person is suffering from a urinary tract infection and the doctor suggested him for urine culture. The laboratory will not produce correct result. Instead of the growth of the urine, they just release the report as a no growth of urine. And the patient came to the doctor with the report, that is, the laboratory said there is no growth in urine, means there is no UTI. But the patient having fever, patient having abdominal, lower abdominal pain, and etc. Now all the symptoms which related to the urinary tract infection. What will happen? The patient will face the wrong treatment, incorrect treatment. The patient will not receive the best possible care. If the particular disease is not diagnosed correctly, then definitely the patient will not receive the best possible care. Suppose a patient having the UTI, but it is misdiagnosed, and patient is now getting treatment on lower respiratory tract infection. This is also not expected. Then next point is resistance to the essential drug may develop and continue the spread of infectious disease. Like nowadays, there are a lot of bacterial species having showing their multiple drug resistance. And like drug like beta-lactam drug, if the bacteria having the beta-lactamase enzyme in their chromosome, means the gene in their chromosome, the presence of the any beta-lactam drug, the bacteria will translate more beta-lactamase enzymes, which actually does not affect on the treatment procedure. Next, epidemic disease may not be identified on time. If we do not report a dengue or a malaria on time, then the mosquito-borne disease will spread. So a reliable laboratory services must needed for our society. And why laboratory is needed in the healthcare? Actually, the laboratory strengthens any healthcare facility by their quality, their efficiency, cost effectiveness, planning and management of the reportable disease or any infectious disease. If the quality of the diagnosis will assure, then only the if the quality difference can the laboratory make to the quality of the healthcare. Let us say about the laboratory investigation increase the accuracy of disease diagnosis. Right? One patient is suffering from the fever. One patient suffering from the fever, and patient came to the doctor. Doctor suggested him the malaria. The laboratory is not in the good practice. They are just using a test, and which is after expiry. They are using the card test after expiry, and which leads to the incorrect result. The patient was negative for malaria, but laboratory produces the result positive malaria by malaria antigen diagnosis. Then definitely patient will go wrong treatment. Okay. So the accuracy is very important. And who will keep this accuracy? Who actually develop this accuracy? The member of medical laboratory technologists and the medical laboratory science. They actually develop this accuracy in the laboratory, because this field is lacking. The persons are working, the person having this depth knowledge in this field are lacking in this field. Only the field is first with a doctor and a very less educated person actually working as a laboratory phlebotomist or the laboratory technician, so-called laboratory technician. though they don't have their proper educational certificates. They don't have the proper education. They don't have the knowledge. They don't have the clear idea. So now this is the time to produce the students, the time to produce the manpower, the professionals who are really will know, who will really have the clear idea about the medical science, about the scientific manners, and the clear application in the virtual medical science. Who are they? They are the starters, BSc from medical laboratory technology. So let us say about the misdiagnosis or the late diagnosis can lead to the incorrect treatment, increased morbidity or the mortality, long time hospitalization, patient dissatisfaction, and the lack of confidence, increased risk to the community from inappropriate disease management and untreated infectious disease. Now, actually medical laboratory scientists who are the leader in the field of medical laboratory or the medical science, medical laboratory science and the medical laboratory technology. These scientists actually perform the full range of laboratory tests and are self-sufficient, who not only report the accurate results but also know when results are incorrect, and they can need to recheck and take the corrective action which is required. But taking the corrective action on time actually inhibits the production of wrong results or incorrect diagnosis. These scientists work very quickly and carefully. They hold life and death in their hands because the information they will give to the doctor which influence the medical treatment and a patient receives. After getting the proper information from the scientist, the doctor will treat the patient and the patient will cure. Not only the scientists involved in the test, the scientists also develop a lot of techniques. They also design a lot of standard operating procedure for the analysis of that particular disease, for analysis of any medical test. And the second category of the medical laboratory is the technologist, medical laboratory technologists. Some of the major roles of the medical laboratory technologists are to carry out the routine and advanced laboratory tests using the standard laboratory methods. And that methods actually designed by the scientists. Apply the problem-solving strategies to administrative, technical, and research problems, which are supervised by the medical laboratory scientists. Conduct community based on the researches in the collaboration with the other categories of health professionals, and the implementation of any research activity or the health related issues in our society, which is under the supervision of medical laboratory scientists. So the technologists are working under the medical laboratory scientists. They actually are the main implementer in our society. And finally, is the medical laboratory technicians. These technicians actually perform the general tests like blood testing, like sugar, urea, creatinine, etc., blood banking, clinical biochemistry, immunology, microbiology, working with the supervision of medical technologies. So these technicians are working under the supervision of technologists. So the technicians working under technologists, technologists working under scientists. This is the group for a medical laboratory science, for a medical laboratory. Therefore, a medical laboratory technician hunts for clues to the absence, presence, extent of cause of disease. They actually stick in their work to find out the origin of any disease. Then the technologist will explain it to the scientist. The scientist will critically research what is the origin of the disease, what is the origin of disease, and how to control this disease. Understand? So medical laboratory technician must be accurate, dedicated, and skilled. They must also be self-motivated and take the initiative to do what must be done every day. Now, finally, for your future, this is up to you. There are a lot of scope in this field, the BSc in Medical Laboratory Technology. The BSc Medical Laboratory Technology, after finishing this course, the person can get the position of medical laboratory technician, they can get the position of medical laboratory technologist and the medical laboratory scientist. These are the futures, and this is up to you, your choice. Which field will you choose in your future? Okay, thank you. Thank you for your kind patience. Hello.
Yes, students, please, if you have any queries.
Is there any query in this regard?
Yes, students, please write any queries in your chat box if you are having. And I want Sak sir, please come in. Shakhar, if you are here. Shakhar, please unmute yourself.
Yes, sir. Hello. Sir,
Yeah.
actually my system was hacked little bit. I'm so sorry. Yes. So students, if you have any questions, as Maji sir said, please put it in the comment section. We will read that out for you. If any queries, anything you have
Sujay
that you would
Babu, I
like.
think you got a query in the chat box and you have written also.
Yes.
That is, the students are asking that it's very risky to work in the laboratory. So if you can answer it for all the students.
This is the this is no risk at all. Okay, before going to the carry out the work, you will know about everything regarding the any disease. Okay, so the preventive action, the infection control practices, you will be know first. Then you will allow to work on that particular any infective agent.
Yes, sir. There are few questions I would like to read out for you. So one student is asking this, sir, after BMLT, do we have to do, like, is it mandatory to do master degree in the same manner to get the higher position?
See, there is always a different way, and there is always a higher way to go to there. After finishing the BMLT, they can finish the MLT, then PhD. After getting the MLT, they will be considered as the medical laboratory scientist. Or if they want to continue their study, if they want to continue their development, then they can finish their PhD. And to perform the PhD, this is the MLT mandatory. Without master degree, PhD is not possible.
Right, sir. Thank you. Sir, another question is there. A student is asking, what are the general apparatus used in laboratory?
Sorry, what is general?
Students, you can unmute yourself.
General.
Hello.
Sir, the question is, they are asking what are the general apparatus which is used in the BMLT or medical laboratory?
General apparatus, like in the discipline of clinical biochemistry, there are a lot of analyzers, biochemical analyzers. For hematology, this is the cell counter and the hematological analyzer. For microbiology, the level 2 biosafety cabinet, laminar airflow, hot air oven, incubator, etc. autoclaves.
Thank you, sir.
Yes.
Sir, another question is there that some a student is asking, can you please, sir, repeat the urine culture report that you have said? Maybe he would like to understand.
Yes, I was telling about the if the if the laboratory is not performing well. Suppose a patient submitted his or her urine for the analysis of urine culture,
Replied.
and the laboratory hello the laboratory actually reporting
Yes.
there are no growth,
Replied.
but the patient really is with urinary tract infection. Due to the bad practice in the laboratory, the report is coming as a negative instead of positive. So therefore, this is the misdiagnosis which leads to the doctor for the mistreatment.
Yes, you can ask students, please. You can ask if you have any question. You can write it in the chat box. And I request Sakor if there are any query in YouTube.
Yes, sir. Yes, sir. There is a query. Yes, sir. Absolutely. So there is a query in Zoom chat as well. So one student asking that how MLT technician and MLT technologist work differently. Like she wants to know the difference between a technician and technologist.
See,
If there is something
technologist
in this.
technologist is the intermediate position between the scientist and the technician.
So there is an intermediate position.
Yeah. The technologist
Okay,
actually
no.
technologist is supervising the technician. Technicians are involved in the routine general laboratory work.
Right, sir. I could not find any questions in YouTube answer. So, students,
Yeah,
I will
here
ask
in
if
the
you have
chat
more
box also
questions.
one question
If you're,
is there. To
yes,
Dr.
sir.
Vijay Kumar Sarkar, we have one question: how MLT technician and MLT technologist work differently?
Sir, he has just answered the
After
question.
after getting the MLT, then the students will be the MLT technologist.
Okay, sir. Another one: can we do PhD properly after completed MMLT? After
MMLT
completion of
and
the
MLT
master
is the
degree.
same.
Yeah.
MMLT and the MLT are the same.
So they are asking for doing
After
PhD
MLT,
in that. After masters,
so
they are asking for doing PhD.
right, sir. And another student is asking that, as you said, like after master degree, can we become the MLT scientist and will we be
Yes, a
called
laboratory
MLT
scientist.
scientist? Laboratory
Is the
scientist.
laboratory scientist.
I think they are so much interested once you said they can become a scientist. So yeah, thank you, sir. Okay, any more questions, students? Please put in the chat box, or you can unmute, or you can ask to the speaker directly. Or if you're listening to me through YouTube, then please put your questions in the YouTube chat box. We'll be delivering that to the or to our speakers as well. So please put your questions. Till now, okay.
Yeah, Shakur, I think no queries are there.
Sir, one more question. The same thing kind of question has come in the YouTube. Like a student, Sondip Shah, wants to know what is the main work of technology? So only to guide the technician or anything else?
Repeat it again, please.
So he is asking that the role or the work of technologist is only to guide the technician or something else.
Now, of course, the guide of technicians and there are several work for the quality control practices is actually depends on the technologist. Not only
Depends
guide the
on the technology.
technician, they should
Okay,
have
sir.
involved in the
Mhm.
procuring the instrument, procuring the reagents, and the quality control practices. So designing the SOP like this.
Okay. Thank you, sir. There are not many questions I could not find, so I think the students are very much excited to hear a lot more from you, sir. Thank you so much for coming here, for joining us, and for guiding our students a lot, because the BMLT is a course which most of the people doesn't know about, and you have given such a elaborated discussion. So thank you so much for that. And we are really very privileged to have you amongst us, sir. And our first year student have got, I'm sure, pretty good idea about it. So I think as we don't have a question right now, with the permission to Maji sir, I would like to conclude the session. And I would like to thank all of the students for joining with us, for staying with us for so long. And thank you so much. You are having another class that is with the whole university team. So the link has been given to your WhatsApp group. Kindly join at 12 p.m. sharp. Thank you so much, and thank you, Dr. Sarkar, for
And
joining. Thanks a lot.
thank you. Thanks all the students, and special thanks to the JIS University for giving me this opportunity to say a little bit about the medical laboratory science and the technology.
Yeah, Dr. Sarkar, this is Dr. Himanshu Shekhar Maji. I got your name and all these things from Asim sir, Dr. Asim Haldar. So we will be in touch. Definitely, we will have a long-standing relationship with JIS University and you. Thank you for being with us today, and we'll shortly find some ways so that we can engage you with our students for better interest. Thank you.
Thank you. Thank you, sir.
So, Shakar, please end the session
sir.
right now and advise the students to join through the other links. So, there an important
Yes,
session
sir.
is going to start.
Yes, sir. So all the students, please join at 12 p.m. The link has been provided in the WhatsApp group of yours. Omkita ma'am have provided that, so kindly join at sharp 12. Do not delay.